We are done.
Not quite as it turned out. Almost as difficult as getting the legislation to reform America's healthcare system signed into law 3.5 years ago has been the process of implementing it. With the Affordable Care Act due to come into effect in just a few weeks' time.
Good morning, everybody.
The president was forced to make changes after it emerged that some people who currently have health insurance actually stood to lose it under his plan.
I am very frustrated, but I'm also somebody who, if I fumble the ball, I'm going to wait until I get the next play, and then I'm going to try to run as hard as I can. But it is complicated, it is hard, but I make no apologies for us taking this on, because somebody sooner or later had to do it.
But the bulk of the problems come down to this, a glitchy government website that's been creaking and crashing and which saw fewer than 27,000 people sign up for coverage in its first month, prompting congressional hearings into the debacle.
We're here to examine a failure of technology, not because the technology was so new and innovative, not because this was a moonshot,
and landing those more used to crunching code in the spotlight.
The website is getting better each week as we work to improve its performance, its stability, and its functionality. We have much work still to do, but are making progress at a growing rate.
Such difficulties music to the ears of the Republicans who've opposed the bill since the start.
The only way to fully protect the American people is to scrap this law once and for all. There is no way to fix this.
Fixing it is essential to President Obama's credibility. With his approval rating at its lowest since he took office, the problems surrounding the implementation of the Affordable Care Act are clearly costing the president the trust of the American people. Getting that healthcare initiative right could have a determining effect on how his presidency is viewed. David Willis, BBC News, Washington.